Hi everyone, welcome to my Optimum Health God's Way YouTube channel. Today we are going to look at conquering gallstones naturally. According to a study published in Clinical Gastroenterology and Hepatology, around 6% of global population has gallstones. In the United States, gallstones are a common condition affecting 10 to 15% of U.S. population. Many individuals with gallstones are asymptomatic. That means it shows no symptoms and they don't even know that they have it. Gallstones are more common in women than men. In women, estrogen dominance or excess in estrogen is leading to cholesterol oversaturation and gallstone formation. Gallstones are most common in people 40 years old or older, or people who have diabetes, people who are obese, or pregnant women, or people who are on hormonal medications, people who eat high fat or high cholesterol diets, and people who don't exercise. Now let's look at definition of gallstones. Gallstones are hardened deposits of bile that is composed of cholesterol, bile salts, bilirubin that form in the gallbladder, which is a small sac or organ that stores bile. Gallstones can range from a grain of sand to a golf ball and are made of cholesterol, which is called cholesterol stones, or bilirubin pigment stones, or both cholesterol and bilirubin combined. Cholesterol stones are yellow-green, whereas pigment stones are dark brown or black. Let's look at signs and symptoms of gallstones. Number 1, either intermittent discomfort or sudden severe pain in the upper right abdomen or in the back or on the right shoulder. Lasts from a few minutes to some hours. Number 2, nausea, vomiting, indigestion, gas, and bloating. Number 3, fever and chills. Number 4, complications. If gallstones block bile duct or pipeline, it could lead to jaundice or infection called cholangitis or pancreatitis, which is the inflammation of pancreas. Number 5, loss of appetite. Number 6, dark colored urine. Number 7, pale stools. Now let's look at effective method of healing. In order to effectively heal any illness or disease, in this case gallstones, we need to ascertain or find out the cause or causes. We need to remove, correct, and change everything that causes. And we need to expel impurities, toxins, and waste left in the body by the cause or causes. And lastly, we need to re-establish the right health principles. Let's look at the first effective method of healing to ascertain or find out the cause or causes. Number 1, diet. Diet high in fat or cholesterol can cause imbalance in bile composition that would lead to gallstone formation. 2, stress. Excessive cortisol from stress can disrupt bile flow, cause the increase of cholesterol production or imbalance of bile production that could contribute to gallstone formation. 3, some health conditions like obesity, Crohn's disease, cirrhosis, sickle cell anemia, and diabetes. 4, physical inactivity can cause constipation, weight gain, insulin resistance, cholesterol buildup, gallbladder motility. That means your gallbladder doesn't move much, or inflammation. 5, certain medications like hormone replacement therapy, antibiotics, cholesterol lowering medications, and others. 6, insufficient hydration. When we don't drink enough water, the bile will be thick and concentrated. That can cause cholesterol, bilirubin, and calcium salt to clump together, solidified into stones. 7, constipation and poor metabolism affects the composition of bile, or insulin resistance, or obesity, which are the risk factors of developing gallstone. 8, not enough bile. When your liver doesn't make enough quality and quantity of bile in the gallbladder to break down fats in the diet, it could cause 9, alcohol, smoking, caffeine, sugar. For example, excessive alcohol drinking can cause liver damage or cirrhosis, which could affect gallbladder and gallstone formation. And smoking affects bile composition and gallbladder function. Caffeine causes dehydration and will thicken the bile, and sugar leads to excess cholesterol and could cause imbalance in bile composition. 10. Infections. Having a gallbladder infections or liver infection can affect gallstone formation. 11. Hormone imbalance like pregnancy or excess estrogen dominance. Birth control pill can cause gallstone formation. 12. Injuries. Motor vehicle accidents, falls or blows to the abdomen can damage gallbladder health. Now let's look at second effective method of healing: to remove, change or correct everything that causes, be it diet, habit or lifestyle. If they cause gallstone formation, remove, correct and change it. The third effective method of healing is to expel impurities, toxins and waste left in the body by the cause or causes in your system. I would like to share with you a simple and effective detox or cleansing method. It takes 3 days. Eat watermelon, antelope, honeydew on those 3 days, or any cleansing vegetable juice like dandelion greens, coconut water, cilantro, spirulina, and take no animal intestinal bowel cleanser, any natural laxatives like cascara sagrada, psyllium husk, senna, tamarind juice, or prune juice. Take it a night before the day of enema. For enema solution, take a good sized bulb of garlic, peel it, blend it with 2 cups of distilled water, squeeze a lemon or 2, the juice of the lemon, add it to the garlic and water solution, drain it, use the solution for about 8 ounces for each enema, once in the morning, in the afternoon and in the evening for 3 days. The last effective method of healing is to re-establish the right health principles, or God's right health principles. They promote good health, that means good blood and good circulation. There are 8 of them. Number 1, godly trust. In Genesis 15:26, God says, I am the Lord that heals you. And in Psalms 103 verse 3, God heals every disease, including gallbladder. All we have to do is ask Him to heal us, trust Him, follow and obey His health principles like we obey doctor's orders. Godly trust is also an antidote to stress. 2. Open fresh air. Oxygen accelerates healing. Negative ions helps boost immune system. And deep breathing is a very good exercise to prevent or to manage gallstone problem. 3. Daily exercise. According to CBS News report, regular physical activity, both moderate and vigorous, has been associated with a reduced risk of gallstone formation. And exercise helps improve gallbladder motility. That means helps your gallbladder moves, functions better to prevent stagnation of bile that leads to gallstone. And exercise helps manage weight by burning calories and helps boost metabolism, which is known risk factor for gallstone formation. And exercise helps improve insulin sensitivity, which plays a role in gallstone formation. Exercise helps relieve pain. For example, yoga poses and breathing exercises are very good for managing pain. 4. Sunshine. Vitamin D helps stimulate liver, make more bile to break down gallstone, cholesterol, in regulating bile exit, metabolism, and potentially reducing inflammation. In sun exposure is associated with a reduced risk of primary biliary cirrhosis, liver problem, which impact gallbladder health. 5. Proper rest or proper sleep have several positive impacts on gallstone patients. Studies suggest that quality and quantity sleep is associated with a lower risk of gallstones by improving gallbladder function and reducing inflammation. And according to a study published by BMC Public Health, sleep positively influence bowel production, gallbladder motility, and sleep. Also helps reduce inflammation and helps support melatonin's role, a hormone released during sleep, which inhibits gallstone formation by reducing cholesterol absorption and improving gallbladder motility. And sleep plays a role in pain management and overall comfort. Very good for managing and preventing gallstone problem. 6. Lots of pure water. Drinking enough water is very crucial to maintain healthy bowel flow, to thin the bowel to flow freely and smoothly, to prevent the bowel from concentrated from forming stone. Drinking enough water helps reduce gallstone formation by keeping bowel moving, so it helps prevent new gallstone formation and helps reduce frequency and severity of symptoms. And drinking enough water helps in digestion, which is very helpful. And drinking enough water helps relieve pain by preventing contractions, and adequate water helps flush out excess cholesterol. 7. Always temperate. For individuals with gallstones, it is very crucial and beneficial to practice or maintain temperance or moderation, to follow health principles, and to shun or avoid harmful or unhealthy. For example, to eat a balanced diet rich in fiber and nutrients and low in fat and sugar, along with regular physical activity and staying hydrated through drinking plenty of fluids and herbal teas, takes temperance and self-control. 8. Nutrition. A balanced diet rich in fibers, nutrients, like in Genesis 1:29 and Genesis 3:18, fruits, nuts, grains, and vegetables, and limiting saturated fats and refined carbs, sugars, white flour, can help manage and reduce the risk of gallstones, and helps promote healthy gallbladder function and reduce the formation or recurrence of gallstone. Food source for gallstone. High fiber foods like fruits, vegetables, whole grains, legumes like beans, lentils contribute to healthy digestion and prevent gallstone. Fruits and vegetables are rich in vitamins, minerals, and antioxidants, good for overall gallbladder health. For example, apples, pears, peaches, pineapples, watermelons, strawberries, oranges, kiwis, figs, cherries, blackberries, melons, raspberries, omega-3 fatty acids rich food like chia seeds, flax seeds, hemp seeds, walnuts, vitamin C rich fruits, oranges, lemons, apples, pears, peaches, pineapples, berries, kiwis, cherries, vitamin D, mushrooms, vitamin D3 supplements, vitamin E, wheat germ oil, safflower oil, olive oil, sunflower, almonds, hazelnuts, pine nuts, avocado, mangoes, kiwi, spinach, red bell pepper, broccoli, kale, collard greens, turnip greens, asparagus, butternut squash, and herbs like dandelion root, milk thistle, turmeric, gold coin grass, ginger, peppermint, artichoke, tamarind, chanca, piedra. Food supplements like better than greens, spirulina, chlorella, sea moss, moringa, wheatgrass, milk thistle. Now let's look at natural remedies. Number 1, fasting, be it Daniel fast or elimination fast or intermittent fasting. For Daniel fast, eat only fruits and vegetables. For elimination fast, avoid or limit high in saturated and trans fats, red meat, fried food, processed food, refined carbohydrates, and sugary food and drinks, pastries, white bread, pasta, cake, cookies, dessert. Drink lemon juice and water in the morning and throughout the day. 2. Olive oil, lemon juice, and water. Drink 1 cup of olive oil and 4 to 5 lemon juice and drink that juice, and then drink about 4 to 5 cups of distilled pure water, and then you lay in a fetus position on your right side until you feel like going to restroom, passing stool, or poop. 3. Castor oil pack and heat compress. Take blue hospital chalks, take a smooth cotton, soak it with castor oil, put it in between the chucks, or you can put in saran wrap and can put it where your gallstone is. Put a heat compress or hot water bag or hot towel for about 45 minutes to an hour every day until you get rid of all the gallstones. 4. Exercise. Walking, swimming, bouncing on the rebounder, hiking, jogging. 5. Make tea out of milk thistle, dandelion root, turmeric, gold coin grass, and drink it 3 to 4 cups daily. 6. Boil 6 to 8 beets in 1 quart water until tender and drink 3 glasses daily. Try to drink 2 to 3 liters of water daily. 7. Try to include beet roots, artichoke, tamarind, olive oil, coconut oil, MCT oil daily in your daily diet. 8. Go on a 2 to 3 day juice fast, and you can include cucumber, celery, carrot, garlic, chamomile, asparagus, parsley, watercress, lemon juice, coconut water in your juice. 9. You can try acupuncture. Acupuncture seems to help influence or improve bowel flow and liver health. 10. Take vitamin C 1,000 milligrams 2 times a day. Vitamin D3 5,000 to 10,000 international units a day. Magnesium glycinate 500 milligrams 2 times a day. Try to take some zinc. Vitamin D2 as in MK7 1,000 micrograms a day. Turmeric 1,000 milligrams a day. Take some herbs daily like milk thistle, dandelion root, gold coin grass, Janca piedra, either 40 drops 3 times a day or 750 milligrams 3 times a day. And artichoke, psyllium husk, stone root, purified bile salt, cod liver oil, boomy amla or stone crusher or breaker, 1 teaspoon 2 times a day. And you can try apple cider vinegar and lemon juice and water. Try to change your lifestyle, diet and habit and maintain it until or even after your gallstone problem is taken care of. Friends, I would like to leave you with 3 John 2. Beloved, I wish above all things that you may prosper and be in health as your soul prospers. Bye for now and see you in my next video. God bless.